Patients have their option as far as what they want to choose regarding laparoscopic banding, gastric bypass, or sleeve gastrectomy. I think the sleeve gastrectomy offers the patient excellent weight loss, a good safety profile, and we're not placing a foreign body like we are with the band. Patients with the sleeve gastrectomy pretty much have everything au naturel. They have their stomach, but it's just a smaller stomach. They're going to eat less, they're going to have absorption that's going to be the same, there's less risk of dumping syndrome, which is something that can happen with gastric bypass. And patients, overall, the weight loss is equivalent to bypass with a lot less risk. And again, most patients, I think probably within the next few years, this is the only procedure I'm going to be doing. We insert a special retractor just in the middle of the rib cage, just below the middle of the rib cage, to elevate the left lobe of the liver. That gives us exposure to the stomach. After that's performed, we take down the vessels by dividing them with a special harmonic tool which divides the vessels and seals them all along the greater curve of the stomach up toward the spleen. That is the part that's going to be taken out. We measure approximately 4 centimeters away from what's called the pylorus, which is the entry from the stomach into the small intestine. And at this particular mark, we start our division with a stapling device up toward the area that we've freed up. After we apply the first stapler, we then place a calibration tube called a bougie that anesthesia passes, and it's a lighted tube and it sits right at the junction between the stomach and small intestine. That's the tube that we now measure out or calibrate our sleeve as we trim the stomach all the way up toward the esophagus. Once that area has been freed, we remove our calibration tube. We have anesthesia insert what's called an orogastric tube when they can pump some air in the new sleeve, and then we look for it to fill up, and then we look for bubbling on the outside that may indicate a leak somewhere. Laparoscopic sleeve gastrectomy, I think, is going to be the procedure of choice in the upcoming future for weight loss surgery. Stop there for now.